The arthroscopic inlay posterior cruciate ligament reconstruction with the PCL TightRope is a technique used to allow minimally invasive reconstruction of a torn posterior cruciate ligament. If the posterior cruciate ligament is not repaired, meniscal tears and arthritis may occur in the knee. The surgeon begins by flexing the knee and introducing a guide through a small incision on the front of the knee. The guide is placed in the original area where the PCL attaches on the lower leg bone. A special pin called a flip cutter is drilled through the bone and into the joint. Part of the drill guide is tapped into place with a mallet to facilitate drilling. By pushing a button on the flip cutter, the tip is rotated into a cutting position. The flip cutter is then drilled back into the bone to create a socket where the graft will eventually be placed. The flip cutter is removed and a suture is passed into the joint and out of the skin for later graft passing. The tendon graft is prepared to match the socket created by the flip cutter. The PCL TightRope is secured to the prepared Achilles tendon bone block. An additional suture is added to secure the button to the tendon. The graft is introduced into the joint by pulling on the PCL TightRope implant. A button is added to the PCL TightRope. The graft is now secured into place. The remainder of the tendon graft is passed into the upper leg bone and secured. The arthroscopic inlay posterior cruciate ligament reconstruction with the PCL TightRope technique allows the graft to enter the knee through a small anterior incision and avoids the traditional large posterior incision on the back of the knee. The PCL inlay reconstruction technique may lead to less graft abrasion and better approximation of native biomechanics.